E amoa ke au I takutoki hahau ai te ora. Ko te ora ki runga, te ora ki raro, te ora ki waho, te ora ki roto. Tēnā toki he toki nā wei, he toki nā rongo take. I whawhai ai te kawatu ai nuku, te kawatu ai rangi, te kawatu ai tāne rua nuku. Tāwhiwhia te ngātoro e takoto nei ki te aho tipua, ki te aho tawhito o rongoma tāne. Tūpore nuku, ko tūpore rangi, ko tūpore hau e hau atu nei. Tēnā toki ka hihiri, tēnā toki ka whitiki, taku toki kairi. Whānau, hara mai te toki, haumi e, ui e, tāi. A tono had come to me to consider that the College of Anaesthetists were wanting me to put together a karakia for their kaimahi and the work that they do. And so I had to really consider anaesthetists and whether that there was some sort of parallel, which there is in Te Ao Māori. And so I just sort of like let it sit, and eventually it sort of came to me that when we talk about a toki, it's like a toki pau tangata is a tohu mana nui, tohu rangatira. And I thought, well, o rātou mahi, he mahi rangatira, because, you know, ka poka haere nei ngā tangata e māwiwi ana. That was pretty serious, pretty important. And so I had to sort of reach in, not just into the back files of ngā karakia e Mohanau, and considered that idea of a toki, not only reflective of the tools that they had to, you know, be a part of in their work, but also this whakaro he tohu rangatira tērā. Haunga te rangatira o te kaimahi, engari te rangatira e takotone, that the person who was requiring that service was also a rangatira, and that you had to hold on to that mana as well. Also, in a lot of old karakia or tātou karakia, there's often phrases that when you dig deep into how te tikanga o tērā kōrero, there's often phrases that our tipuna used to bring a balance. And so when we say, ko te ora ki runga, te ora ki raro, it's talking about a balance, te ora ki waho, te ora ki roto. Tūpore nuku and tūpore rangi, which are two words that come up, that's also balance. And so that seemed to be quite important in a frame of mind when they go into the mahi, and not just about themselves, but I know that they consider deeply the ngātoro or the tūroro that they have to work for. Now, tēnā toki, he toki nā wei, nā rongo take. Now, there's plenty of rongo, rongo mātāne, rongo maraero, rongo take, rongo whakaata. These are different atua that carry the name rongo, and rongo is if you think of it as a departmental goddess, ko te atua tunu tēnā o te hauora. Rongo is also the atua of peace, but rongo had this really strong sibling, not battle, but a good close relationship with Tūmatauenga, who is the atua of the opposite of war, strategy. In one particular battle, these two fought side by side against the Tini Opoto, which was an army that was sent to attack Tāne and that crew, as well as Tua and Rongo. And so the next line, which says, I whawhai te kawatuai nuku, te kawatuai rangi, te kawatuai tāne ruanuku, that's in reference to all those germs and different illnesses that were sent by whiro to attack them. In that battle, Tūmatauenga fell, almost a fatal falling, and uttered as Tū fell, Te Rongo, I think I'm done for. And Rongo was the atua that not only continued to fight the germs, but also helped to heal tōna tuakana. And so ka ora tunu a Tū, and I roto I tērā ka ora no te tangata. Whitikia tēnei ngātoro e takotone, that Rongo would bind and keep this ngātoro that is lying here. Now, ngātoro is the no word for patient, for a victim. Ki rea kāka whakarongo ake rā koe I tai te ngangi o te ngātoro, which is the screams and cries and wailing of the victims. So ngātoro is another word that was used in this karakia to reflect the patients that the college and the anaesthetists had to work with. So whitikiria o tāwhiwhia, te ngātoro e takoto nei is to bind them, to clothe them in safety. Te aho tipua, te aho tawhito, so that's the thread o rongo mātāne. Because rongo is got quite a huge portfolio, not just an atu of health, but an atu of food, an atu of peace, an atu of the senses, an atu that's related to the human puku. That's quite a thread that you want to be able to bind this patient in. And so koera te ia o tērā kōrero whitiki te ngātoro e takoto nei i te aho tipua, te aho tawhito rongo mātāne. Tūpore nuku and tūpore rangi were two cloaks that were created for rongo. Hau in this reference is another word for the spirit. Tūpore is ana hea kupu anō tērā mo te cheki, te manaki, te penapena. Nuku is the physical well-being and rangi is the spiritual well-being. And tūpore hau is to look after the spirit of the person because ka moi rata and e hau atu nei, to keep the spirit alive. Tēnā toki ka hihiri, ka whitiki, really take a hold of this tool, this mana, and taku toki kairi, and fly into the mahi that you have to try and achieve. So koera katoa ngā whakaaro kai muri i ngā kupu. I think that it's a karakia that can be used in general for ngā take arongo take, that it can be used not just for the kāhui poka, but I think it can also be used for the kāhui matehine ngaro, GPs, katoa. Although it talks about tools, it's not specific about the tools. It talks about the mana and the capabilities and abilities of the person providing the service as opposed to being an anaesthetist. It doesn't hang a pū. It's more hora than it is puta. Our tīpuna, because they had such depth of reo, they were raised on an ideology attached to the universe that they could create karakia off their top of their head and speak to that level of understanding and what it is that they wanted to achieve, i roto i te kupu, to be able to use that type of reo, put you in another whole headspace. So I think use them ka ora ngā karakia i a tātou, kia kaha te whakamahi te karakia, kia kaha te taki i te karakia, te ako i ngā karakia.